Physician engagement is a central challenge across the healthcare landscape. Catholic healthcare, like all for-profit or not-for-profit health delivery settings, struggles to recruit, engage, and retain physicians. For Catholic healthcare, though, the mission and a commitment to promote and defend human dignity, attend to the whole person, and care for poor and vulnerable persons aligns with physicians' personal values.
We have the ability to pull upon and call upon in a very open and honest way the spirituality that is embedded in healthcare and that is driving us to recognize that each life that comes in and turns their life over to us is a sacred life. And in Catholic healthcare, we have the ability to express that openly, honestly, and to discuss it.
The physicians that serve with us, they have to see us walk the talk, that we have a deferential regard for everyone, and that we see service to women and men and children who are poor. We have to reflect in how we come across and invite the physicians that this is an issue of justice. We believe this is a right, and therefore not only just doing a lot of charity care, that's like water in the sand. What we want to do is how do we work together to change the systems, the access points, so that they're also involved in it. And I think we also have to remember, with all the charity that we put ourselves to do, we have never, ever done it without the physicians.
The physicians do have a serious business side that they have to look at. They graduate with medical bills, student loans that they have to pay back. But again, they want to serve those who need some special attention. I will tell them stories about a young man that we saw who had had a temporary colostomy because he had a bowel obstruction. He was out, he became uninsured in the process, and he couldn't have the surgery to be made whole again. Well, we were able to, again, with the help of our volunteer physicians, take care of this young man, get the surgery that he needed, and he is back whole and working and doing fine. I think that appeals to physicians. It appeals to their hearts, and they say, okay, I can't do this all by myself, but I can do it with the hospital, I can do it with some of the resources that you have, and together we can make a difference.
So in this current environment, what exactly does Catholic healthcare offer that is different?
I think the environment allows you to be a better person in Catholic healthcare because of its witness to life, because of its care about justice, because of its concern for the poor. Those parts in you that can sometimes get beaten down, there's a place to be nourished and to be reinforced by that. And then with the spiritual side, to be in a place where the sacraments are available, where prayer is a real part of the day, I think that's just a tremendous balm for a busy physician.
Well, a lot of people say there isn't any difference, and I think that's a challenge to us to be clear about what it is that's different about us. We have the same CAT scanners, we have the same medications, we do the same operations, but I think it's how we take care of patients, our concern for the patients, the family, the wholeness of them.
This student colleague of mine is Jewish, and he said he was assigned at Holy Cross Hospital, which is a Catholic hospital in Silver Spring. And he was very nervous because he had this idea of nuns in full habits walking in the hallways and that he'd be proselytized and he wouldn't be respected for his diversity of beliefs. And he said it was the best experience. And so as a fourth-year student, he chose all of his elective rotations to be at Holy Cross Hospital. Why? He said it was hope-filled hallways at this hospital, that he recognized in Holy Cross a place where people could be healed. He said everybody understood that attending to the spiritual dimension was so important in a very appropriate way that he felt that his own calling to service was supported there more than any other place. So you don't have to be a Catholic physician, you don't even have to be a religious physician to work within Catholic healthcare, but you will be supported there if you want to help people, and if you want an administration that's going to be behind you in terms of helping people provide compassionate care.
Just as healthcare ministries should provide a different environment and value systems where physicians can do their work, leaders of these ministries should be looking for something different from the physicians.
Well, I hope they do look at every patient as a person, recognizing that in that continuum of care from birth to death, that there is a person who's traveling on that journey. And even though we know we can cure them today or keep them healthy tomorrow, or that they're going to need palliative and hospice care for an end-of-life event, the issue is Remember, this is a person who is equal to everyone and needs to be treated with the values that are embedded in Catholic healthcare, and that of dignity and justice for all.
Professionalism for a Catholic physician is very much to realize that you are continuing the work of the divine physician, and unless you get in touch with that, you're going to burn out and act like a jerk. Because I know the times I act like a jerk, it's usually not because I've been in touch with God.
I look at it more as, if this were my family member laying in that bed, how would I want them to be treated? If it were me laying in that bed, how would I want to be treated? Compassion is something we're taught from childhood across all religions. And when you go into medical school, you go into medical school because you believe that you want to help people, humanity. And as you grow as a professional, with your personal life experiences, you become even more enriched by those experiences, and you learn to incorporate other people's values and different cultural backgrounds.
The interpersonal skills are so important on the team. Being able to work with everybody else on the team, being able to communicate well, being able to make sure that the people who are working on the team know what the physician has planned for the patients, and being able to take time to teach. Physicians have a lot to offer the rest of us, and if they take the time when there's a patient issue or a patient problem, if they take the time to teach the rest of the team, it makes for much better care for all of the patients.
Physicians often struggle to balance their personal and professional lives. As a ministry of the Church committed to holistic care, what can we do to engage them and partner with them on their professional and personal journeys?
Giving us feedback as to, okay, this worked, this did not work, this patient's family complained, but listening to both sides of the story and saying, okay, this family complained, but let's hear your side of the story and try to find out where this went wrong, where the communication broke down. And probably providing communication seminars that will help people realize multicultural differences, religious differences, and become more sensitive and more aware, instead of us living in a cocoon saying, I take care of the medical part and somebody else is supposed to fill in the rest of it.
Part of the challenges with physicians is that they're often not considered staff within a hospital. And so activities occur in a hospital for staff, and then it's, oh, and by the way, we should include the doctors. And that, I don't think that's really a good policy or a good way in trying to include the doctors. So to make them feel that they're integral part of staff as well, include them on committees, help them lead teams as well as be participant in teams, and really engage them in their ideas.
It's difficult to sometimes find a place that is almost a sanctuary where you can have the opportunity to engage our docs out of the hubbub, out of the chaos that is so much of their lives. But if you can do that, and sometimes it's a meeting, sometimes it's a retreat, sometimes it's a weekend away with the medical staff, then you can have a chance for them to reflect and kick back kind of and get back to their roots.
Being a physician is joining a profession and committing to a vocation. As a general internist, I always advise my patients to have time for their families and for themselves, and exercise, to eat right and take good care of themselves. I probably need to be reminded of that. I think that, again, just like it's important to create the time and the space, I think that institutions can communicate that through their schedules and through their expectations of the members of their medical staff, that they know that that's important and that the time is created for it.
Physicians don't have time or the energy to come to some big meetings all the time. I do, though, like it when someone talks to me about what's going on in my life and provide me an opportunity for that. And I know that that's the way a lot of my friends are, too. If we could develop that within Catholic healthcare, I think we'd really transform the ministry.
Moving forward, Catholic healthcare must commit to engaging the gifts of physicians more fully, not only as healers, but as leaders too, and to providing further opportunities for medical students to understand just what is possible when they choose to practice in this ministry of care.
Over the last several decades, both compared to other institutions in an absolute number. There are now fewer residents training in Catholic institutions than there were in the past. I think there need to be more. What I want to challenge Catholic healthcare institutions to do is to really commit to a tremendously important, not the only part, but a tremendously important part of the team, and that's the development of physicians. There are new medical schools that are opening up in the United States every year now. And there are not going to be enough places for all of those graduates to train. I'm quite serious. I think you're not really engaged with the future physician workforce unless you can commit to being a training site where you can provide an opportunity for people to see how Catholic healthcare is done, so you can show, not just say, why you think it's different. And if you can't do that for future physicians, then maybe you're not really engaging your medical staff.
If we want a vibrant health delivery setting, then everyone involved has to be engaged, and we cannot have that without the physicians. And if you look at it today, what's happening today in many of our places, we now have an integrated physician entity, which is part of the actual corporate structure. They're on our boards. We turn to them for advice. And when there is honesty and a commitment to what the vision is, who we are, why we exist, and how we're supposed to do it, we're not always going to agree on every way to go, but the principles are there to drive us, or to show us the way.